You're all set, Cindy.
All right. Hey, thank you. I guess, we still had some people that were just joining us late as well. So we're going to go back to the very beginning and just do a quick, short intro. Again, sorry for the technical issues here, but we'll go ahead and get started again. So just welcome everybody to the Joint Information Center meeting. It's Wednesday, December 9th. You've seen the administrative notes. You've seen some other things that we have. But I want to introduce our Unified Command Team representing Calhoun County. Today is Kim Archambault. We have the City Manager, Rebecca Fleury, and we have the Calhoun County Public Health Department Officer, Eric Pessel. I'd like to also introduce two additional speakers today. Kara Beer, Battle Creek Area Chamber of Commerce President, and we have Dr. Richard Van Enck, who is Bronson Healthcare Director of Infection Prevention and Epidemiology. Welcome to the both of you, and we'll be hearing from them shortly. We have our Joint Operations Center lines of effort and priorities. Those have not changed. You'll see as we move on to the next slide, the purpose of the Joint Information Center. And then the next slide, we have our agenda, which will be our order of brief. So at this time, I would like to reintroduce Eric Pessel to talk about our current situation. Good afternoon, Eric.
Hey, thanks. Good afternoon, Jim, and everybody. So just going over our numbers again, of course, these are our totals, and they have gone up considerably since the last time we were together. We're now at 6,083 positive confirmed, laboratory confirmed cases in Calhoun County. We've had a total of 309 patients hospitalized. And what I want to point out more than anything is our number of deaths is now at 135. I did a quick check, and back on October 20th, we were at 50. So that's a significant rise of deaths over the last really just about a month and a half. Of course, that's obviously something that's very concerning, and another reason why we really need to get a handle on this surge and be able to start to bend this curve back down. It does look like maybe another week's worth of data hopefully will show us that curve possibly is starting to bend in a positive direction. As you can see on the graph there, it is starting to drop off on the right side. But I think we're going to need another week or 10 days worth of data before we could say that it is in fact decreasing. If it anything, worst case is it's at least flatlined right now. Next slide. Okay, and this slide is a new slide that we wanted to bring out today that really just talks about our overview of our pediatric cases. And we've heard from some folks, there's an order out right now that I know Rebecca's going to talk about later that has taken all high schools, 9th through 12th grade to virtual. And we felt like, well, let's give you all our Calhoun County numbers by age so you can break that down and see what's going on here in the county. And this is all time since March 1st, a total accumulation of numbers, but you can see we really didn't start to grow exponential numbers in our adolescent age groups until really when we went back to school there and actually as it moved into the month of October. But we do break it down by age, and you can definitely see that the older age groups are where we're seeing most of our cases of COVID amongst our youngsters. And that is one of the reasons I believe that data is pretty similar across the state of Michigan. One of the reasons that it was a decision was made to go virtual 9 through 12 was because I think that same data was elsewhere. We continue to keep an eye on that, and we continue to work with our schools, understanding that group is the group that is obviously being exposed more than the younger kids. And some of that we don't know yet, but we are looking into whether or not that is sports and athletic related, or is that just the fact that they're older and they move around more, can gather outside of school together and not necessarily transmit during school. So we will, as we move forward, probably continue to show some of this type of information so that we can keep an eye on what's going on with our kids. Next slide. We spoke about this last time, and I wanted to go through this again, that the vaccines are just about ready to be approved. We are anxiously awaiting the FDA's meeting on this, and expect by the end of the week, or at least by the end of the weekend, we'll have some good news that for now the FDA will determine that we have safe and effective vaccines, at least one on the market in the Pfizer vaccine. As we discussed before, right now the plan in Michigan and the plan here locally in Calhoun County is this vaccine will be broken up into multiple phases. Phase 1 being again broken down into 3 parts of phase 1. And we will roll these out both through our hospital systems and other systems, pharmacy systems, in the local health department to these initial phase 1A, 1B, and 1C populations. Next slide. Again, this is just it kind of takes that 1A and breaks it down a little bit more for folks to kind of get a better understanding of who is included in the 1A. And as you can see, obviously hospitals, long-term care facilities, outpatient clinics, home health care, pharmacies, emergency medical services, and public health. And then examples of long-term care facilities are your skilled nursing facilities. And of course, those are not Calhoun County numbers of beds. Those are state of Michigan. I wish we don't have 1.3 million beds in Calhoun County for nursing homes, but those are a breakdown again of the other types of long-term care facilities that we have. So you also have assisted living, you have residential care, that also includes adult foster care and places like that. So our staff are continuing to work daily on vaccine planning. And, we're going to be meeting here very shortly with our hospitals and our healthcare providers to make sure that we're having a coordinated effort here in Calhoun County as this begins to roll out. We are under the belief and understanding that as vaccines start rolling out after they're approved, it is going to be slow in the beginning. We're not going to receive a whole lot of vaccine to even be able to get through all of our 1A recipients right away. So as we turn into the month of January and into February, we'll start to see more vaccines coming online and probably get some more vaccines in our hands to be able to continue through our phase 1 folks. And then eventually we'll be able to get to phase 2. And the reason I bring that up now is I think it's so important in our messaging in the community, and for all you leaders that are on this call, we have to do everything in our power to continue to follow the basic messages of how people protect themselves. And we have to do that for the next, several months. I hope that people don't think, okay, the vaccine is here, we can stop wearing a mask, or we can start gathering again. And that's just not the case. We're all going to have to continue to do this for at least the next couple months until we get enough vaccine and get enough people vaccinated in the county for us to be able to start to open up and start to go back to more of a normal situation. But that is a ways off. Next slide. I'm going to end right here. We had this slide up last time. It just talks about the 3 vaccines that are the closest to being approved. Like I said, we're expecting the Pfizer to be approved, this weekend at the latest. So with that, and with my message to everybody is we still need to double down on our efforts to protect ourselves and our family and our community. Wear a mask, stay socially distant, more than 6 feet apart. Try not to gather with more than people in your household when you're gathering indoors. And I think that is my last slide, Jim, and I'm going to turn it over to Dr. Van Eck.
Yes, thank you very much for that report, Eric. Much appreciated. At this time, I would like to introduce Dr. Van Eck, as he's going to speak on the importance of vaccine along with the virus impact on hospitals. Good afternoon, Dr. Van Eck.
Hi, can you hear me okay?
Absolutely, thank you.
Okay, thank you. Thank you. It's a pleasure to talk to you. I agree with everything that Eric just said. I would maybe dig a little bit deeper. The tier one, or the healthcare workers, being the earliest group, there's some things that you might hear about that I'd like to maybe clarify. Some people have been saying that the reason why healthcare workers should get the vaccine first is that they're at the highest risk. And that is not true. Healthcare workers are not at high risk. In fact, your local hospital is probably the safest place that anyone could possibly be from the COVID virus. And so the reason that healthcare workers are first is because you need us to take care of you when you get sick. So it's more an issue of us being essential for the community than of us being so vulnerable or at risk. We're protecting ourselves very well against COVID, but we would like to continue doing that. And so that's why we're getting the vaccine first. Bronson has a great program already started and in process for giving the vaccine to all healthcare workers. But that, of course, is not very many, right? If you look at how many healthcare workers are in Calhoun County, it's what, 1,000, maybe 2,000 or whatever. So that's not very many. We're not going to turn the pandemic curve down just by immunizing healthcare workers. It's going to take huge numbers of community people to be immunized in order to turn that curve down. The real beauty of a vaccine, however, is that it protects you 24/7. If you wear a mask, it only protects you while you're wearing it, right? But if you get immunized, you're basically protected 24/7. So it not only protects you as an individual, it protects your family because you're less likely to spread the virus to them, and it protects the community. So that's lots of reasons to take a vaccine. Vaccines are weird drugs in that they're the only drugs that we take that protect people that don't take them. Think about that. It's a drug that protects people when you don't take it, because if you have somebody that's immunized, you're protecting them because you're not going to spread that disease. All other drugs that we give only affect the person who takes them, but vaccines protect people that don't even take them, because if we get enough herd immunity in the community, we can stop the spread of this pandemic. Talk about how good the vaccines are and how good the data are and the research and the science. We have done, or the pharmaceutical companies have done, all the proper studies to measure safety and efficacy on these vaccines. It's just that we're seeing those data sooner than we normally would. And the FDA is seeing those data sooner than they normally would. And so they'll be able to assess the data and approve the drugs faster than they normally would. So it's not that we have less data or less accurate data, or that the studies were sloppy or something like that. It's all the same studies that we normally do for any drug, but because the FDA has been seeing these data come through, they have a very good picture of what this drug looks like basically tomorrow. The meeting is scheduled for tomorrow, that the FDA is going to meet on this and take a look at it and say, is this drug safe? Is this drug good? And maybe some of you are aware that in the United Kingdom, they started giving it a few days ago. And so they're a little bit ahead of us, but we will catch up pretty soon. So that's kind of the story on the vaccine. If we do get vaccine, when we think we will fairly soon, it will probably be the Pfizer vaccine, and we'll probably get it maybe sometime next week. At least it may be shipped next week. I'm not saying it will be in the city or in the hospital or in people's arms next week, but it will be in a situation where it will be leaving a warehouse somewhere and probably be in the supply chain and on its way to its eventual location where it will be administered. So that's why vaccines are important. And I'd like to segue then into why hospitals need vaccines on the next slide. The problem with COVID is the slide that Eric showed right at the beginning that showed that big surge. That's basically what we're feeling in the hospital. that is a large surge of patients, a large number of patients with the same disease all coming in, together and stressing the healthcare system. They're all cared for together in one location in the hospital. And these are not necessarily, people who aren't very sick. Some of them are quite sick. Some of them are critically ill, and some of them are dying. So these are not easy patients to take care of. They require a lot of resources, both in terms of supplies and drugs, and particularly healthcare staff, doctors and nurses. They take a lot of attention. So this is a resource-intensive disease to treat in the hospital. So when you have a large number of COVID patients in the hospital, like we do at Bronson Battle Creek, it stresses the system a lot. And so we would like to see those numbers go down, and we can go back to delivering babies and fixing broken legs and taking out people's appendix and things like that. Normal stuff. We would like these COVID patients to not get COVID, and so they don't have to come in and take up beds and take up resources to take care of. So that's the stress that we're seeing. And then, of course, because we have a large number of these patients, and they're in addition to all of our other patients, our nurses and doctors are working extra hard. So if you think about it in terms of a vehicle, it would be like running your vehicle at red line day after day after day. Well, engines are not designed to run at their red line that much. They can do it a little bit, but not very much. And so basically, when we have this pandemic and people are not protecting themselves and they're getting COVID and they're having to go to the hospital, that means the hospital is stressed. And there's a limit, there's a limit to how much stress the hospital can handle day after day after day. So that's why we would like people to take seriously the risk of COVID and do those things that you can do to reduce the risk. And they're listed there on that slide. Wear a mask, keep socially distant, and avoid gatherings of people that are not within your pod or within your bubble that might bring COVID into your group. And of course, wash your hands. So those are all the standard things that we have to do before we have the vaccine and after the vaccine that are essential in order to keep the county or the city infrastructure going. I think I'll stop there and answer questions now or at the end.
Dr. Van Ack, thank you so much for joining us today. There is a question in chat. I'll go ahead and read it. If somebody has already had COVID, should they get the vaccine when it is their time, category-wise, to qualify to be vaccinated? I'll go ahead and let you respond.
Yes, the recommendations now are that everyone should get the vaccine, that can get the vaccine. And so it really doesn't make a lot of difference whether you've had COVID before or whether you have antibodies to it or whatever. I think if you say, well, I had COVID before, so I don't need the vaccine, you're kind of overthinking it. I think it's better to just immunize everyone and try not to exclude people. Now, I would say there's some validity of saying you might not need to be first. Maybe you can get yours in February instead of January, but you should still get the vaccine even though you might have some immunity to it. More immunity is always better.
Very good, thank you. If there are any more questions for Dr. Van Ack, go ahead and please put them in chat, and we will go ahead and get those addressed as soon as we can. Again, thank you for that report. Okay. Moving on, we're going to talk about the MDHS order extension, and I'd like to introduce our city manager, Rebecca Fleury.
Thank you, Jim. I appreciate that. I'll take the next two slides. So I think we all know that Director Gordon of the Michigan Department of Health and Human Services ordered an extension of the state epidemic order for an additional 12 days. So instead of expiring December 9th, it is now in place until December 20th. If you watched his press conference, you know that wasn't made lightly. His concern are the numbers. So I keep thinking of exactly what Eric said and what Dr. Van Eck said. Those numbers in that surge are concerning, and I think his office is doing everything we can to try to get those numbers to come down because of the stress it's placing on the system, the hospitals, and communities in general. But we do know that the state officials are also discussing metrics around the holidays, because holidays is all about gathering. And unfortunately, this is a virus that doesn't help when you gather. And so exactly what Dr. Van Eck said is that you should just be gathering with your own pod or bubble. You don't want to introduce any other households into your gathering that may bring or be carrying COVID. So the extension of the MDHS order extends limitations on indoor dining, continuing extent limitations on indoor dining. And as Eric said, no in-person high school delivery of education face-to-face. Public transit systems are continuing to operate, and so are childcare systems. And you can find more at the michigan.gov coronavirus, but you can also go to those links from both the county's website and the city's website. So please take a look. They have some really good metrics and charts about safe restart. And be mindful of all of those things that we've been telling you since March. They're still valid right now, even during this extension time. Next slide, please, Cindy. I think we know that the limitations on indoor dining is very difficult for our small business owners, particularly for those restaurants. And so, unfortunately, restaurants, we ask that you continue to follow the state order to help prevent the spread of virus, and that indoor dining is incredibly limited. And to our community, please think about continuing to support those local restaurants, but just not eating indoors. Please use carryout, curbside, and delivery services. I've been amazed at how creative our businesses have come to help meet this limitation. And so there's a lot of options for you to consider. Some restaurants are providing their own. I saw the Lucky Rooster is doing their own delivery, but also think about trying things like Eats BC in Battle Creek. So they have contracted with local restaurants to help facilitate your order, either pickup and or delivery. I know that I took advantage of that just last night, and it was very easy. So please go to eatsbc.com or use other services that will help you continue to patronize our local restaurants. And remember, the guidelines are to limit your gatherings, but not to limit your support of local businesses. They need us now more than ever. And together we can protect our community if we follow these things. Thank you.
All right, thank you, Rebecca. Appreciate that report. Moving on to talk about our business update, I'd like to introduce Kara Beer. Kara, good afternoon.
Hi, good afternoon, everyone. Thank you, Rebecca, for bringing and plugging the restaurants. That's great. Eats BC has grown over just a short time that they've been in existence. I've met and chat with the creator of it, and in just that short time that it was created, they had already done over $200,000 in delivery services. So that is great. That means that people are taking advantage of our delivery system that we have created, and that's not including Grubhub, DoorDash, or any of those, or the personal delivery services. So thank you. Couple things to bring your attention to. Number one is the Pure Michigan Small Business Relief Fund is actually, applications start December 15th. That's next week. That is a program that is a grant program. There's $10 million in that fund, and that is specializing specifically to certain industries. And those industries, and it's a grant of up to $15,000. But the industries that are eligible for the Pure Michigan Small Business Relief are bars, lodging, live event venues, movie theaters, conference and meeting facilities, indoor recreational facilities, gyms, and fitness centers. So that is something that really brings up a great point in the sense of these are all local small businesses that have been a part of this, that are seeing a great big deal of impact. Especially our bars, and that we have a couple that are strictly bars and not really known for their food. This has made a big impact since the beginning of COVID. So looking at that, and that fund is going to go live on December 15th. So I always encourage folks that are a part of those venues to go on and apply. This is one of the caveats of that grant, though. they have to be abiding by all of the regulations that are set forth through COVID-19. And so if they are not abiding by those, they will not be eligible to receive that grant of up to $15,000. One thing that we have noticed through all of our funding that we've been doing, our local businesses are looking more for those grant aspects rather than the loan aspects, because that a grant would be able to help and sustain them for a little bit rather than pulling out a loan and knowing that that payment could really bankrupt them later on. So wanted to make sure I touched on that today, but also just a point of reference for a special chamber member benefit that we have going on. We announced it on Tuesday at our eye opener. We have our holiday chamber cash gift certificate program, which is we've partnered with our town match program, which is sponsored by Consumers Energy. With this program, it is meant to be individuals purchasing $25 gift certificates. And with that, it's a one-to-one match. And we have put an expiration date on all of these gift certificates of March 31st, 2021. That is to have people take advantage of this and do that in that first quarter of the year. And so that's really when a lot of them were saying that we aren't sure if we'll make it through the first quarter. This is to help ensure that they'll be able to. That's about $30,000. That is $30,000 in gift certificates that would hopefully be used between now and March 31st. They are $25 increments. There is a limit on the number of gift certificates that you're able to purchase, which is 10. So that means that if you purchase the 10 gift certificates, which is $250, you will end up having $500 worth of gift certificates in your hand. So if you are interested in learning more about that, you can email me. My email is provided on the slide, but also we will have our office will have time from 11 to 4 starting on Monday, December 14th for you to purchase those. I think you can go on to the next slide. Thank you. It's really important. Rebecca mentioned this in her report. This is a small business season right now. And some ideas of really looking at is eating local. Takeout Tuesday, maybe you pick a day as a family and maybe it's on Tuesday, maybe it's Thursday, maybe it's Wednesday, but you eat local and you utilize those services. The other thing is shop local. There are a lot of amazing shops locally that we can take advantage. And looking at this as the Joint Information Center, this is countywide. We really want to encourage people to take advantage of the whole county and what we have to offer. And so that is something there. And then also making sure you give some digital love. And what I mean is if you order, like Rebecca Eating Eats BC, snapping a picture, leaving a review on their Facebook page or on Yelp or Google, but taking a picture and sharing with folks that that's something that you did is really important. They're looking for people to promote them on social media. It's an easy, free way for people to get out there and show that. We've got some great Facebook groups out there that are promoting eating and dining locally. The igloos is another thing that we have a number of our restaurants that are buying those igloos that people in pods can sit in. Those are a hot ticket commodity. I've talked to a large number of my counterparts from across the country, and every single restaurant is looking to purchase pods and they are sold out. So that now we have people being very creative and creating their own pods or their own igloos. So we do that. One of the other thing is that to go that extra mile, make sure that you're tipping for your service providers. It's really important to do that right now. But also if you have a business membership or a subscription to a local business or facility, to keep paying that. That's what's going to keep their lights on and hopefully not impact their business too much. And then I also put on there, make sure you send a local business a holiday card, bring some cheer to them as well. So that is my report. I see I have a question in the chat from Carla. Once you purchase those, if you pay through credit card, we're using PayPal to do that. So if you email me and let me know that you have your gift certificates, All you need to do is let us know. We can have you pick them up on Monday, starting on Monday, or you can we can mail them. We just, with everything with the mail service, we didn't want to bombard people and then maybe not get those gift certificates in time. So we're giving lots of options on that, Carla. But safely.
Thank you, Kara. Yeah, great report. Thank you for the information. All right, we're moving on to the point of the presentation where we're going to hear comments from elected officials, and I'll go ahead and go down in order here. And we'll start with Senator Bizon. Good afternoon. Any comments from Senator Bizon or his representative?
Hi, everyone. This is Karen Todd, Senator Bizon's office. Just wanted to let you know the Senate is in session today. There are many bills on the floor. One that Senator Bizon wanted me to update you on today is the open meetings bill, electronic meetings of public governmental bodies. The Senate is set to vote on that bill today to extend it from, I think it ends at the end of the year, to extend it until March. The bill would extend it until March, and of course could be extended again after that expiration date. That is Senate Bill 1246 if you wanted to look at some of the details of the bill. Again, that's on the agenda for today. If you would like to watch Senate session, as I said, there are many bills that are being voted on here in these last few days of session. Or if you want to watch committee hearings live, you can go on to the Senate's website. That's senate.michigan.gov. Dr. Bizon chairs the Senate Families and the Families, Seniors, and Veterans Committee, and they are meeting today at 3 p.m. and that'll be on live on that website. So that's all I have. Thank you.
All right, thank you, Karen. Representative Hosma, or any representatives from his office.
Thank you, Jim. This is Jim Hosma. Unlike Senator Dr. Bizon and the Senate, the Michigan House is not meeting this week. It's not meeting because of positive COVID. So we've missed numerous session dates this autumn because of positive COVID test of members. Meantime, we hope to get in next week and extend some COVID-related deadlines and supplemental appropriations. Negotiations continue for the balance of the year, and I'm hopeful that we'll be able to extend some relief to unemployed workers, those unemployed by reason of COVID, and to small business owners who are impacted deleteriously by COVID. Thank you.
All right, thank you, sir. Representative Hall, or anybody from his office. Hearing none. Any county elected officials at this time?
Yes, this is Commissioner Hatcher here, and I would just like to take this time to state that, as everyone here on the call knows, we have experienced some COVID cases in the county jail. And also with some of our employees, we're just asking that, everyone think about that and keep everyone, do what we can to just keep this from spreading. But most importantly, I just would like anybody and just remind people that this is that time of the year. So reach out to any seniors that that are especially shut down more so because of COVID, so that we can just reach out to our seniors. And if anybody needs any help doing that, please reach out to me. Thank you.
All right, thank you, Commissioner. Any other county elected officials? Moving on, do we have any comments from tribal elected officials? Any city elected officials? Any township elected officials? And finally, any village elected officials? All right, hearing none, we'll check chat one more time as we come to the conclusion of this meeting. If you have any questions, please fill it out now in chat. The next slide just shows you some best information sources for Calhoun County government, City of Battle Creek, the state of Michigan, and the CDC. The next slide is a contact list for our PIOs. We got Lucy Blair from Calhoun County. You got Victor Jovanovich from the Health Department, and Jessica Vanderkolk from the City of Battle Creek. Seeing that there is no more, or there are no comments in chat, does anybody have any comments that would like to come online? All right, thank you everybody for joining us for this this presentation, the Joint Information Center. We'll see you all next Wednesday. And if you have the invite, remember tomorrow is our JIC at 9 o'clock. Or I'm sorry, the